Thank you, Saria, and thank you to Olivia and the Pension Research Council. I'm so honored to be here to present this paper on behalf of the Age-Friendly Foundation, Aging 2.0, and my colleague Amanda Henshin, who's Executive Director of the Age-Friendly Foundation. Next slide, please. Research on making it easier for people to work longer has tended to focus on economic security. This paper links working longer to health and longevity. Purely age-based retirement policies have led to complications and unintended consequences, including insufficient retirement resources, possible depletion of Social Security, and flawed perceptions of older workers. By working longer, older adults are better able to support themselves, remain healthier, and possibly live longer. New data we've generated show that when employed, older adults are as much as 4 times more socially engaged, offsetting deepening concerns worldwide on the adverse effects of loneliness, particularly on older populations. The very definition of retirement should be reconsidered in light of increasing data suggesting that traditional retirement can be detrimental to financial, mental, and even physical health. In this paper, we discuss the business case for older workers, the societal health case for people working longer, and finally, how working longer benefits older adults themselves. Next slide, please. So the business case. For more than a century, the world has been aging steadily. Between 2015 and 2050, the number of adults over 65 will nearly double as a percentage of population overall. Overcoming misconceptions about older workers is crucial to expanding their access to employment. Research supports the business case for older workers. Next slide, please. Do the strengths offset the costs? Despite the benefits of employing older adults, there are perceived costs as well. These costs may be smaller than generally thought. Whether the economy is strong or in recession, there is no evidence that increased employment of older workers negatively impacts younger workers. Research suggests, in fact, the opposite may be true. More than 90% of employers now offer performance-based rather than just tenure-based compensation, reducing or even eliminating salary cost differentials around age. Among those who are less skilled and work in administrative jobs, 25-year-olds earn comparable amounts to 55-year-olds. And among middle managers and other professionals, 35-year-olds earn comparable amounts to 60-year-olds. What about healthcare? Healthcare does continue to be more costly for older workers, though that differential is shrinking, and one very noteworthy exception exists. Next slide, please. So the exception. The cost of providing health care for older workers can be less for small employers, as much as 70% less. This exception applies to employers with fewer than 20 full-time employees. Here's why and how this works. Federal law lets smaller employers establish a less costly Medicare Supplement plan for employees over age 65. While younger workers will continue to be covered by the employer's regular health care plan, older workers may choose to file for Medicare, and the employer is permitted to provide a supplemental plan. To illustrate this a bit further, a small business might pay $300 a month to subsidize a 36-year-old employee's health care, but only $100 a month for a 66-year-old's. The financial benefit applies to both the employer and the employee. This is important because the cheaper rate for an employee provides them with an incentive to make that switch. Medicare Supplement plans, even ones with low deductibles and co-payments, can be purchased for far less than all-inclusive health insurance. This exception is noteworthy. It's noteworthy because of the difference in cost, as I just mentioned, but also the fact that about 20 million people in the United States work for organizations with 20 or fewer employers. That's 1 in 5 American employees. The majority of organizations that are this size offer healthcare. Less expensive healthcare benefits for older workers negates one of the most significant costs cited when not employing older workers. Over the last 15 years at retirementjobs.com, the team has observed anecdotally that age discrimination is less acute in smaller businesses. Here's another reason why businesses can be financially incentivized to seek out older workers. This exception's not new. It's just one that hasn't been publicized to date, and therefore it's not as widely utilized as we would like to see. Here is an opportunity for policymakers. Next slide, please. The societal case. Working longer is similarly beneficial to the economy as a whole, increasing gross domestic product, providing more available skilled and less skilled labor, reducing the cost and burden of caring for older adults, and helping to shore up federal Social Security systems as workers continue to make contributions through payroll taxes. Next slide, please. There's benefits to older workers themselves, in addition to the value derived from employers from the participation of older workers. Consequently, it's imperative that our society makes it easier for older adults to remain engaged in their communities, particularly through work. In addition to reaping employment, they will be healthier for it, less isolated, and happier. A survey conducted by retirementjobs.com and the Age Friendly Foundation in January compared the difference in interpersonal interactions among older adults who are employed versus those who are not employed. The survey, which was sent to 300,000 adults aged 55 and over, asked respondents how many different people they speak to in person during an average day. Those respondents who identified themselves as unemployed reported significantly fewer social interactions than those who were employed. While only 15% of the unemployed respondents spoke to at least 10 different people each day, 4 times more, or 60%, of employed respondents had this same volume of social interaction. Even among those who were working remotely, those employed were nearly 3 times more likely to interact with 10 different people every day. This data lends further weight to the theory that continued employment helps stave off social isolation and its resulting ill health effects among older adults. Next slide, please. So in conclusion, there's a trend underway to working longer, suggesting people are willing and feeling the need to convert their sustained health into more years of work. By facilitating new or continued or new employment of older workers, we're not only potentially adding more years to these individuals' lives, but adding more life to their later years. When looking at increases in longevity, we need to characterize the additional years as adding to the middle of one's life, not just the very end. We also need to recognize the societal benefits of facilitating longer work lives. The gift of longevity has simultaneously produced an opportunity, also a monumental challenge for society. We call upon leaders to form public-private partnerships work across silos, geographic borders, and political boundaries to innovate, to change attitudes, and ultimately make it easier for older adults to work, also to volunteer later in life. This change will keep our economies and our citizens' quality of life growing well into the future. Thank you.